Historically, the medical profession and health professions have not focused on the health of LGBTQ people. For better or worse, the AIDS epidemic made people pay attention. 41 years later, medical providers are still not trained to provide the competent, exceptional, tailored care that LGBTQ people need.
I live in New York City, and yet I had to work hard to find an LGBTQ-friendly general practice doctor.
When I go to a doctor, I have to start the conversation all over again, right? Every time there's a new physician, I've got to say, well, this is who I am, this is what I stand for. I have a child, a 28-year-old, who identifies as non-binary, and that's a whole other kettle of fish, right? That doctors don't know what to do with at this point in time.
And you can imagine in other parts of the country how challenging it can be to get affirming, respectful, and knowledgeable care specific to LGBTQ people and their needs.
The Center for Health Identity, Behavior, and Prevention Studies, or CHIBPS, is a biobehavioral research center that focuses on the health of LGBTQ populations, advances the science of healthcare, and also serves as a training ground for the next generation of scholars. So basically, there's two focuses. How do we learn more about the health of LGBTQ people and improve it? But also, how do we make sure that there are researchers and scholars who are going to do this work in the future?
Dean Halkitis is not only a visionary, but he also accomplishes the vision.
Ever since they hired Perry, the school has taken an entirely new direction. It's vibrant, it's energetic. He's opening doors that have never been opened before. I don't know what the school would do without someone like him.
I'm Kathy Ahern O'Brien, and I am the Executive Director at Hyacinth AIDS Foundation. Hyacinth is an HIV service organization. Our mission is to help people live with HIV, stop the spread of the epidemic, and serve as a critical voice in the debate surrounding HIV in New Jersey. The LGBTQ community, one of our biggest challenges is that we're not counted, right? So there's no SOGI data that's collected. So when we apply for funding, for instance, and we say, well, I know that gay men are underserved in Middlesex County in New Brunswick, I have no data to support that. It's anecdotal. And so we need centers like CHIBPS who can say, we're doing the research, here's the data that you need to support the work that you're doing.
We take into consideration all those social factors and all those social conditions, including like discrimination and homophobia, whenever we conduct studies with that particular population. We take also a lot of attention to whom do we include in the studies that we conduct? To what extent do we create and build a body of knowledge associated with sexual and gender minorities, but a body of knowledge that represent the most vulnerable sexual and gender minorities in society, right? In the process of conducting this research, I collaborate with community-based organizations to do that research, but to make sure that the findings from that research is implemented in interventions that are likely to change the outcomes of those populations.
Nothing really happens without a team. I can't do anything as an individual, but by holding hands with Dean Halkitis and all of the others, that's how we make change, good change. That's how we move an initiative ahead.
Recent legislation in places like Florida and in Texas that deny the identities of LGBTQ people in schools, in healthcare clinics, is going to have a profound effect on the population, and it's going to make the health of the population even worse than it is right now. So we can change people's behavior, but we also have to change the society in which they are living, because society is the fuel that causes people to perhaps act in ways that is not ideal for their health.
I think the future of CHIBPS is in the students who are joining us and bringing in what they're excited about and they're passionate about.
I tell my students every semester when I teach the LGBT health disparities course that I look at it as a privilege to be able to engage with them in that capacity. When you talk about the LGBT community, you talk about the spirit of connectedness, you talk about the spirit to live, the spirit to overcome everything no matter what is thrown at them.
Rutgers is the first, and as far as I am aware, only school of public health to have a degree in LGBTQ health. Students are able to really get a holistic and in-depth understanding of the needs of LGBTQ populations and how to address those needs through a public health framework.
The resources are in place here in New Jersey. You have a governor who strongly supports it. You have guard state equality here in the state. It tends to be more proactive in the policy space. And I think this gives, coupled with Perry's interest, his experience, and his motivation to shape the center, it really could serve as a best practice for other universities to follow.
The future's kind of endless. We've got a lot of different opportunities ahead of us to really build out what this education, community, and research arm can look like together.
I want to say to people, particularly to young people who are questioning, wondering, thinking about their sexual and gender identities, that there's a lot of us out there who are in really powerful positions right now, who are going to continue to fight for you. So don't give up.